Welcome! Let's start with our first CPT code 11720. In our CPT coding book, its description reads, debridement of nail or nails by any method or methods, 1 to 5. So that means either one toenail is debrided or up to 5 toenails are debrided. We will use CPT code 11721 if 6 or more toenails were debrided. To report a toe location modifier, see from this list. Our example primary diagnosis for nail debridement is tinea unguium. The ICD-10-CM code is B35.1. LCD reference article number A56680 states that this is an acceptable diagnosis for a nail debridement procedure to be covered by Medicare. For more information on which diagnosis can be used, please refer to the CMS website. Also, for CMS LCD L33922, Medicare will consider the treatment of fungal or mycotic infection of the nails a covered service when the medical record is justified. We will talk more about this justification on our upcoming video lectures. In case you do not see the diagnosis of tinea unguium in a progress note you're working on, look at the table in this slide and find the other terms that your physicians may alternatively use in the documentation. This list shows our acceptable secondary diagnosis when applicable and necessary for billing and coding a covered routine foot care service. Let's talk about some guidelines in billing and coding for a covered routine nail debridement procedure. First, make sure when you submit a claim that the date when the patient was last seen by the PCP is indicated. Also, please note that only once in every 60 days will the routine foot care procedure be covered for Medicare patients with certain systemic conditions. Documenting the class finding modifier is an essential part of submitting a valid claim. This means that there must be class findings documentation in your encounter. The modifier is either Q7, Q8, or Q9. Again, more on these in our succeeding lectures. What is an ABN form? ABN stands for Advanced Beneficiary Notice of Non-Coverage. According to Meridian Healthcare Solutions, any service like removal of calluses or toenail trimming are routine and an ABN is not necessary. Unless your patient has a coexisting systemic condition, treatment for mycotic nails is routine, so an ABN is required if criteria are not met. In compliance with CMS-R-131, this form is issued by foot and ankle clinics in situations where Medicare payment is expected to be denied, so make sure the date of service in your claim is indicated. Review the date when your physician previously provided the same service to the same patient and compare it with the current date of service in your claim. Is it already past 60 days? Did the patient completely fill out the form? Many patients do not read through the content and miss selecting the options they are signing for. The ABN form serves as a notification to their patients that the service being performed may not be covered by Medicare and will therefore be billed as out-of-pocket to them. By the way, reminder again, while most insurance companies follow Medicare guidelines, not all of them do, so double check the particular guidelines of your respective payers. Let's look at the table in this slide. For LCD reference article A56680, a routine foot care procedure on a patient with either of these systemic conditions is valid and only covered if the patient is under the active care of a primary care physician, an MD or DO, who documents the condition. This is why the date last seen by PCP I mentioned before is so important. These systemic conditions that you see here now do not require that patients be under the active care of their primary care physicians. Again, if your patients do not have a systemic condition, your claim will be denied as non-covered routine type foot care service. So now you know more about nail debridement procedures. Make sure your documentation is complete and it supports the billing and reporting of nail debridement procedure codes. That is all for now for our part 1 lecture video. I hope you learned a lot. Up next is part 2 lecture video on billing and coding for foot care services that are not covered by Medicare.